Good morning, and welcome to the launch event of Paediatrics 2040. My name is Toby, and I'm part of ANDUS, a group that has been analysing collected voice data and listening to the changes that children and young people would like to see in paediatrics in the next 20 years. First of all, though, we would like to take a moment to thank all paediatricians for the work that they do already, for which we are all grateful. The top issues that we think are important to bring to light are working with us and prioritising key skills, children and young people's mental health and mental health in a crisis. Any questions that you may have can be answered on the Voice Matters section of the microsite. I will now pass off to Anwin on working with us.
Hi, my name is Anwin, and as part of the Paediatrics 2040 project, RCPCH and us worked to establish the main features of the Working With Us that children and young people said was most important to them. Paediatricians involved in the care of children and young people should continue to be respectful, kind, supportive and friendly, empathetic, understanding and actively listen, open-minded and to be aware of different backgrounds and experiences of young people. Children and young people across the nation said that the worst doctor is someone who does not respect their feelings that they're going through with their health. We want doctors to be accepting and have a non-judgmental approach whilst continuing to be professional, positive and have a sense of humour. I will now pass you on to Izzy, who will talk more about what children and young people have said they want to see.
Hi, I'm Izzy. I will be continuing to talk about working with us. Keep doctors human, said young people in England. How then do they propose to enact this? Some ideas put forward by young people across the UK included finding new ways for paediatricians to show listening to explain things, a choice of what gender paediatrician they were seen by, and support for paediatricians with topics new to them, such as LGBTQ+ issues and eating disorders. Young people feel that the best doctors are those who can listen to children and young people, and they want to ensure that the right people choose paediatrics and love their occupation in the future. Whilst it's inevitable that technology will be even more prevalent in the year 2040, young people still see a place for face-to-face appointments with real human paediatricians. Overall, the message from young people is for paediatricians to keep listening and respecting children and young people, to be open-minded and trust them, and to treat them as people, not just as a condition. Many other ideas and further detail and statistics on the topic can be found on the Paediatrics 2040 Voice Matters microsite under Working With Us. I'll now pass on to Noor.
Hi, my name is Nora and I'm going to be talking about mental health. As young people involved in Paediatrics 2040 sessions, we believe a focus on mental health should be a priority. Mental health problems affect around 1 in 9 children, although in 2020 this number increased to 1 in 6 children. As per our mental health infographic, we have 4 main focuses. 1. Removing the stigma around mental health. This will take time, effort, lots of education, and a change in attitude. As mental health can affect physical health, and physical health can affect mental health, we want every paediatrician in 2040 to have had mental health training so that both physical and mental health care can be integrated. This way, young people will be more inclined to open up, and so ultimately, the stigma around this will be reduced. 2. Making sure people feel comfortable asking for support. We want mental health support to be accessible at all times by using technology and social media so that support is there at the press of a button. 3. Supporting good mental health and well-being. This should be done through encouraging sport, healthy eating, and public health campaigns discussing issues such as addiction, bullying, and eating disorders. And 4. Ensuring young people have opportunities to deal with their mental health both at school and at home. We believe that having a wellbeing clinic at schools where one-to-one discussions and follow-up sessions are easily accessible will give young people more opportunities to address their concerns. I will now pass on to Demi.
Hi, I'm Demi and I'm going to be talking to you about mental health and the issues that can occur within a crisis, how we can improve the mental health services during tough times. Children and young people involved in Paediatrics 2040 sessions have talked about the impact of COVID-19 on their mental health. They stated that things to remember are to ensure children and young people don't feel forgotten about, to provide health promotion messaging, to ensure confidentiality during home appointments is there. What does the ideal mental health service look like in 2040? We have discovered that COVID-19 has impacted children and young people's mental health greatly, but from a bad situation of a global crisis, positive changes can be made. We spoke to young people but got shocking feedback that stated in a crisis like COVID-19, how could they complain and suffer when there's people who are worse off? This just shows how big of an impact a crisis can affect young people and their opinions of finding help. This is a reason that things need to change and shows that there's still such a stigma. We spoke to children and young people all across the UK. These are some of their quotes. It's a pandemic, so I can't talk about my mental health when all that is going on. They should have a range of options so young people get anxious on a phone and some young people get anxious meeting the professional in person, so they need both options. I would rather wait it out than go for help, so not to burden the NHS. Make sure there are opportunities for me to do things to support my own mental health. This shows that young people feel as if they're a burden or get in the way or aren't as important as other members of society and don't seek help when they need it most. For children and young people in a crisis, it can be isolating, and when COVID hit us, our health services adapted so quickly. But was that at a cost? With telephone appointments, that means there's no confidentiality at home. Can we fix it? Maybe if we all work together. We spoke to 57 young people that talked about COVID-19 and the future of healthcare. They said important areas to focus on within the Paediatrics 2040 work streams are supporting mental health services to adapt quickly to provide online or phone-based support that meets the needs of children and young people using them. Help staff with new normal, with a strong focus on the well-being, resilience and mental health support for patients, families and staff. Create new ways of working that support confidentiality in the home so that children and young people can talk about private matters with doctors. Listen and hear young people. Give us options. So as you already know, you're all great doctors. But these 4 ideas are to help make the system better, which in turn make you greater. Thank you for listening. I'll now pass you on to Bryn.
Hi, my name is Bryn, and I'm going to conclude today's speeches. You've heard a lot of ways in which children and young people would like to see paediatric care changed or continued in 2040. Today's topics have highlighted when working with us that doctors should continue to be compassionate, and they need to make sure the patient understands everything he or she is saying so that they can feel involved in their care. We've also heard a lot of ways in which mental health should be a priority in the future, and how children and young people would like doctors to know more about mental health and how to help their patients, not only with their medical condition, but with their mental health as well. Some ways that doctors can help their patients through mental health problems is by showing them that they're not alone, and to provide support and access to mental health services. As COVID-19 has had such an impact on children and young people's mental health, we should see this as an opportunity to change things for the better. I think the single most important factor for the future has to be mental health. Not only can mental health take a massive toll on the child or young person, but the effects on the medical condition also make it, in my eyes, the most important factor that doctors should consider and understand more by 2040. Finally, I have to say it's easy for us to say doctors need to be doing these things by 2040, so on and so forth. But we need to understand that doctors are already doing so much, and so these suggestions are not to fundamentally change them, but make them better. Thank you for listening to us today, and we hope you enjoyed the rest of this event. Please visit the Voice Matters part of the microsite to find out more from children and young people.